Cancer is a complex disease characterized by the uncontrolled growth and division of abnormal cells in the body. Normally, cells grow, divide, and die in an orderly manner. However, when genetic mutations occur in a cell, the normal regulatory mechanisms are disrupted. These abnormal cells may evade apoptosis, programmed cell death, and grow uncontrollably, forming a mass called a tumor. Cancer can be benign, non-cancerous, or malignant, cancerous. Malignant tumors can invade nearby tissues and spread, metastasize, to distant parts of the body through the bloodstream or lymphatic system, making them life-threatening if untreated. Types of cancer. Carcinomas are the most common type of cancer, originating in the epithelial cells that line the surfaces of organs, skin, and glands. They can affect organs such as the lungs, liver, kidneys, and stomach. 1. Carcinomas. Examples: lung carcinoma, breast carcinoma, and squamous cell carcinoma, skin cancer. Sarcomas arise in connective tissues such as bones, muscles, cartilage, fat, and blood vessels. These are less common but often aggressive. 2. Sarcomas. Examples: osteosarcoma, bone cancer, liposarcoma, fat tissue cancer. Leukemia is a cancer of the blood and bone marrow. It occurs when the bone marrow produces abnormal white blood cells that crowd out normal blood cells, impairing the body's ability to fight infection, carry oxygen, and form clots. 3. Leukemias. Types: acute lymphoblastic leukemia, ALL, chronic myeloid leukemia, CML. Lymphomas begin in the lymphatic system, which is part of the immune system. Abnormal lymphocytes, a type of white blood cell, grow uncontrollably and may accumulate in lymph nodes or other tissues. 4. Lymphomas. Types: Hodgkin lymphoma, non-Hodgkin lymphoma. Melanoma originates in melanocytes, the cells that produce melanin, the pigment responsible for skin color. It is a type of skin cancer that can spread rapidly if not detected early. 5. Melanomas. Common signs: asymmetrical moles, irregular borders, and changes in color or size of skin lesions. These cancers develop in the brain or spinal cord and are often challenging to treat due to their location. 6. Cancers of the central nervous system. Examples: glioblastoma multiforme, meningioma. Causes of cancer: mutations in DNA can activate oncogenes, genes that promote cell growth, or inactivate tumor suppressor genes, leading to uncontrolled cell division. Mutations can be inherited, e.g., BRCA1, BRCA2 genes in breast cancer, or acquired over time due to environmental exposures. Substances that cause DNA damage and increase the risk of cancer include: 2. Carcinogens. Tobacco smoke, linked to lung, throat, and mouth cancers. Asbestos, associated with mesothelioma, a rare lung cancer. Alcohol. Excessive consumption raises the risk of liver, breast, and esophageal cancers. 3. Radiation. Ultraviolet, UV, radiation. Prolonged sun exposure without protection can cause skin cancers like melanoma. Ionizing radiation. Exposure from medical imaging, e.g., X-rays, or nuclear accidents can damage DNA and increase cancer risk. 4. Infections. Human papillomavirus, HPV, causes cervical, throat, and anal cancers. Hepatitis B and C, linked to liver cancer. Helicobacter pylori, associated with stomach cancer. 5. Lifestyle factors. Unhealthy diet. Diets high in processed foods, sugar, and saturated fats increase the risk of colorectal and stomach cancers. Lack of physical activity contributes to obesity, a risk factor for various cancers. Obesity, associated with breast, colon, and endometrial cancers. The risk of cancer increases with age as cumulative DNA damage occurs over time, and the body's repair mechanisms become less efficient. People with weakened immune systems, e.g., HIV, AIDS patients, transplant recipients, have an increased risk of certain cancers, such as Kaposi sarcoma and lymphoma. Understanding cancer progression. Cancer progresses through stages. 1. Stage 0. Abnormal cells are present but have not invaded nearby tissues. 2. Stage 1. Early stage cancer confined to the primary site. 3. Stage 2 and 3. Cancer grows larger and may invade nearby tissues or lymph nodes. 4. Stage 4. Metastatic. Cancer spreads to distant organs or tissues. Prevention and risk reduction. 1. Healthy diet. Focus on a plant-based diet rich in fruits, vegetables, whole grains, and lean proteins. Avoid processed foods and sugary drinks. 2. Regular physical activity. Aim for at least 150 minutes of moderate exercise weekly to maintain a healthy weight and reduce inflammation. 3. Avoid tobacco and limit alcohol. Quit smoking and limit alcohol intake to reduce the risk of multiple cancers. 4. Sun protection. Use broad-spectrum sunscreen, wear protective clothing, and avoid tanning beds to prevent skin cancer. 5. Vaccinations. Get vaccinated against HPV and hepatitis B to lower infection-related cancer risks. 6. Routine screenings. Regular screenings, e.g., mammograms, colonoscopies, can detect cancer early when it is most treatable. 7. Stress management. Chronic stress can weaken the immune system, so adopt relaxation techniques like meditation and yoga. Cancer is a multifaceted disease influenced by genetic, environmental, and lifestyle factors. While some causes are beyond control, many risk factors can be mitigated through proactive measures such as a healthy diet, regular exercise, and avoiding harmful substances. Early detection through screenings and awareness of symptoms significantly increases the chances of successful treatment. By making informed choices, individuals can reduce their cancer risk and lead healthier lives.